My name is Anita. I grew up on the West Coast in California. I am in my 40s and I work a regular job just like anybody else. I have been fortunate to be able to do so. I know that there's a lot of people with MG that really struggle with that aspect. I went to college. I finished law school. I work in human resources instead. And my journey with MG really began a long time ago. My journey with MG began probably when I was about 4 years old. I remember that the onset of my symptoms, I just all of a sudden felt very dizzy, very fatigued, very lightheaded. And I just felt like a lack of energy, like just a drained battery. And I just remember growing up, it's like the world was always moving and I was just observing. I also kept falling asleep in school. I was often scolded by teachers, ridiculed, laughed at by students for falling asleep, or they just really thought it was funny that I would do that. And so early on, like I said, I knew there was something wrong. When I was about 16, one of the very first things that I did was I started going to the doctor because I thought, oh, good, now I can really focus on what is wrong with me. And no answers. I barely graduated high school because of it. I was so tired and so fatigued that I would forget what my assignments were. I was just, falling asleep in class. I became combative with teachers because obviously, if there's something that you're doing that is looked at as a disciplinary issue, but yet you have no control over it. I mean, I guess everyone has their own response. My response was to fight back. And it was just this feeling of always just feeling very misunderstood. And so I did not think that I was ever going to end up going to college. I was in ROTC and I had wanted to enlist in the military, but I started to see that there was just how would that be possible? There was no way that I could see any consistent physical performance in myself to where I'd be able to pass any kind of PT. So I started looking into, how I would get into college. What I realized I could do was I could go to class and then I could sleep for an hour in my car or at the library, and then I could do the next class. And so the difference was that I went from being a C plus, maybe B minus student to getting straight A's. And so I went to the community college a couple of years. Then I went off to UC Berkeley. The thing about this though is that it's a struggle. I say the story in this way because it was a struggle this whole time with MG. It was almost like I was playing a video game with an invisible attacker. I mean, I knew there was something going on, but obviously I didn't know what it was. People would say to me, Anita, why do you take all day to finish school? Why don't you just do all of your classes like 9 to 1 and then you're done for the day? You can take a break and then study, at night, or take an hour break, study, and then, after dinner, you have free time for, television or whatever you enjoy. And I'm like, you don't understand. I have no free time. The way that this works is this is my life all day because this is the only way I can do it because I'm too tired, is the way I would explain it to people. So at that point, MG was already, really affecting, my social relationships, affecting my life. My last year at UC Berkeley, I almost dropped out, did not know why, I just did not feel well. But true to form, MG sort of comes and goes over a very long span of time in intensity. And that time I didn't think I was going to make it through, but I did. I stuck it out and then I made it through finals. And then the next semester was my final semester. I actually fell during spring break and I hit my head. After that, I didn't kind of feel quite right, but I went ahead and I graduated. And then about 3 months after, I had my first big, like, MG attack, you could say, where finally it wasn't just what I felt inside, it was physical because I couldn't move my hands or my arms. They just stopped working. I went to the emergency room and I was told by the emergency room physician that it was tendinitis and my hands were shaking violently, but it looked sort of more like a Parkinson's. And I just remember telling the emergency room doctor, I said, don't you think that this looks more like a nerve? And he said, no. That's just a muscle twitch. That's common with tendinitis. I tried to push back a little, but I mean, there was really nothing for me to draw from other than, what was going on. But I did not have any pain at all. Then what happened was that he referred me to physical therapy, occupational physical therapy. And I was told there that this was an overuse syndrome and that is why my hands were shaking and that the muscles had become so weak that I could not use them. So the physicians were very secure in their diagnosis that that's what this was. As I tried to do the physical therapy, I couldn't do it. They sent me back to work because it took some time, but that had a little bit more use in my hands. And this is kind of inconsistent with the thoughts on MG, but I'm just going to be 100% honest of how it happened to me, because I know that there's more people out there that it happened to them this way as well. So the way that it happened for me is when I went back to go work on the register, after a while, I just sort of felt like a hatchet, like some sort of like an axe or hatchet had come down in between my pinky and my ring finger. And it was just the most intense, horrible pain. And then a similar pain on this side. And later I found out that that's where your ulnar nerve is. And that's when the pain started. The shooting pain, the numbness, the tingling. Again, all of these things are inconsistent with the modern thoughts on how MG works, but this is what happened to me. And then what started to happen was I started to get a lot of pain up at the base of my neck, on each sides of it, down my trapezius, at various points of my trapezius muscle on my back. My head started to feel like it was too heavy for me to hold up. I thought that was really strange. They sent me, like I said, again, back to physical therapy. By this time, I had stopped working. The more they pushed me in physical therapy to try to do the exercises, the worse I would become. And not necessarily in terms of pain, but my arms just didn't work. And they would tell me to do things, and I would say, I can't. And so then they took that as a psychological issue. Patient is uncooperative. Patient, when asked to do something, patient says that she can't. Patient believes she cannot do it. And they would ask me, Anita, why do you believe that you can't do this? And I would say, well, it's not what I believe. I really, honestly, I can't do it. And they're like, why? And I would say, because my arms don't work. And it was just a back and forth. It was like playing who's on first. I was in my very early 20s, and it was me against all of these professionals, educated professionals with years of experience. I guess luckily, because I had already had that experience of being misunderstood by educators, by teachers throughout my life, I had already developed that stubbornness, inner fortitude to just continue to stand up for myself. And so I did, but it was very, very scary. Finally, I was referred to a neurologist, and because this was all a workers' comp injury. Allegedly, this is what I believed at the time. I thought it had to do with that fall during spring break, and I kind of still do. I'll circle back to that just in terms of some of the thoughts about autoimmune disease and what triggers it. Once I was with that neurologist, he started to try various medications on me because what they saw was that I had a lot of inflammation in my muscles and stuff like that. And I told him, well, all that came when I was forced to do physical therapy that I could not do. Anyway, so they started to give me anti-inflammatories and just various, I guess, muscle relaxers. One of them, I thought I was going to die. There was so many of them. There was like Celebrex, Vioxx. I can't even remember the names of all of the different medicines that he would try. And one of them I remember, Soma. I took it like one time and I didn't wake up for maybe 2 days. And I just remember at some point, I have this to this day, it's just a sort of vague memory of maybe having stumbled to the bathroom. Like I think I took it on a Wednesday at like 11 in the morning, and I never woke up until Friday, sometime late in the afternoon. And I just thought, God, I just keep having these very strange responses to the medications. And that really frightened me. Then I started lying. He would give me a medication, and most of them I tried them maybe once. But at a point, I just stopped trying them because I kept feeling like the medications were going to kill me. And it would just be one dose. And when I would tell him what my response to the medication was, he would look at me so strangely because, yes, it could be a response, but it was just sort of inconsistent with the normal side effects of the medication. It was a little bit too much over the top. He believed me though, but he was struggling with it and he couldn't understand what was going on with me. And he told me that. Anyway, one day I was already almost a year into this, and I was desperate. I was driving through Chinatown and I just saw this sign for acupuncture. And in my mind, I continued to have the belief that this wasn't just tendonitis and fibromyalgia. They called it repetitive strain injury, myofascial pain, just a bunch of different names for it. Anyway, I saw this clinic for acupuncture. I went in there and I started to work with that acupuncturist. And I avoided my next appointment with my doctor because after about 6 to 7 weeks with her, I started to improve and I was able to regain some of the function of my arms. And so when I finally did go see my doctor after about at least 8 weeks, he saw that I was better and he said, "Oh, great. Did the medication work?" I said, "No." And then I told him what I had done. And I said, I know that this is probably not really something traditional, but this is something that I decided when I was driving through Chinatown as I left your office the last time that I came. And I haven't had any relief from anything else. My hand function, my arm function, nothing has improved. My head still feels like it weighs 1,000 pounds, barely hold it up on my body, but this has helped me. So interestingly, he was open to it. And I know I was pretty lucky. He said, "Well, if that's helped you," he said, "the only thing is, how are you paying for this?" Because one of the things that's never talked about with rare disease is how it affects your income, your financial stability. It affects so many things. And I didn't have anything. My neurologist, he believed me. And he said, let's get somebody to pay for that. I have an acupuncturist here that the insurance will pay for. And it was somebody else in town. The insurance company would pay for. And I went to that individual and I'll be honest, it didn't work out. So what I had felt with the first person was the moment that the needles went in, the pain instantly, it just cut off. And it was the only relief I had had in months. And so that's why I continued with it. And one of the biggest lessons that she told me was that, no matter what's going on, you have to center yourself, try to keep yourself as at peace as possible. And it doesn't matter what the condition is, but if you're stressed out, if, you're overly anxious about it, she said, whether it's me, a Western medicine doctor, or anybody, it's not going to make it any better. It's going to make it worse. So, let's work on that. Let's focus on that. And she could barely speak a lick of English and I don't speak Korean, but we made it work. So anyway, so she had gotten me, like I said, a lot better. That next acupuncturist didn't work out. And then what my neurologist had suggested to me was biofeedback. So I went to biofeedback and I have to say that helped me a lot as well. I know that there's been a couple different doctors who've given, lectures on, I guess, using these holistic type methods for symptom control. Honestly, yeah, they're not going to cure you. They're not going to stop your disease from, progressing if it's progressive. But whether it's MG or anything else, and certainly in my experience with MG, they are helpful for symptom control. I still to this day use acupuncture for symptom control, and it's been helpful for me. One of the triggers of autoimmune disease is stress is recognized as a trigger. In terms of exacerbations, stress is on the list too. Whether it's emotional or physical stress, the interesting thing though is that not all the stress is negative. Being very, very happy about something can also trigger your MG, which is strange, but that is something that over the years that I definitely have found to be true. But anyway, that was when I was about 23 years old. So I had about 10 months of my arms not working. They started finally functioning sort of again. And it was a slow process, but over 2 years, they started to work enough. And then I was so mad because I thought that I had gotten hurt at work that I decided that I was going to be an advocate for injured workers. And so I signed up for law school, not knowing what I would get myself into. And I was not 100% healed. And I knew that, but I thought, well, over the time that I'm in law school, I'll heal. Well, I didn't know anybody who'd ever been to law school, or I didn't know any lawyers. I didn't know anything about law school and those kind of professional programs and how they work. So it was very intense. And so not exactly healing. The only accommodations that I had were some extra time for my tendonitis flares. And everyone say, "Oh my gosh, that's so great. You got extra time." The thing about it is that I tried to explain to people, well, sort of, but the thing is that my arms don't work. So when they don't work, they just don't work. It's not like I can push through it somehow. There was times I typed my law school exams. There were times when I typed my law school exams with like one or two fingers, just trying to get through it. I didn't do the best academically, but I finished. Then I started working for a law firm. The bar exam, it was at that time in California, it was 8 hours for 3 days straight. It was impossible. for me to make it through. And I tried to explain to people, I don't know what it is, but my vision becomes so blurred and my fingers, I'm unable to use them to type. There's no way I have the endurance for that exam. And obviously, people interpreted that as, well, the bar exam's a tough exam. And this is a self-confidence issue in terms of MG and the way that, it affects you, because what all of this is building to is probably the psychological effect that having something undiagnosed does to a person. And so this whole time, I'm thinking, there's something wrong with me. Nobody knows what it is. I keep going to the doctor. They keep telling me I'm fine, not going to pass this bar this way. There's no way that I can do it. It's not something I can overcome, because believe me, I'm stubborn. If I want to accomplish something, I will, work tirelessly to try to make it happen. But I physically couldn't make it happen. Very misunderstood. And so what I decided to do was just leave that profession altogether. I came very close. I missed it by 8.5 points. At the time, the passing score was like a 1440, and I kept getting like a 1431.2, 1431.8. But anyway, so I just decided to move on. And I just thought, every time after I took the bar exam, I took it a few times, I would flare really bad. What I would now, characterize, I know, as a flare. And so I just stopped, and I just walked away. And I just thought, if I could just focus on finding out what's wrong with me, and if I can figure it out, then I can proceed with my life and use my law degree, or even if I don't go into law, it doesn't matter. But however I want to make my life. So I should say that at this time, I'm several doctors in. I think at that point it was mostly internist and ophthalmologist. I know for sure in law school, because I had blurred vision, that I had gone to many ophthalmologists trying to figure it out. They had characterized that as dry eyes and maybe even ocular migraines. For the sleep problems, I could never get help. I tried melatonin. It made me very sick. The symptoms that I had at this point were none of the hallmarks of MG. I never had those. I did not have double vision. I did not have the ptosis. What I did have was, every single day of my life, shortness of breath, difficulty breathing. I felt like a lot of processing issues, cognitive type issues. It would affect my memory. I did notice sometimes that my voice was different. There was a time period where I had this sort of like tiny toddler voice, I would call it, like a raspy little voice. And that was bizarre. I had a lot of urinary incontinence, urinary urgency, like at night, where I'd have to get up at night and go to the restroom. And this is since I was like about 20 years old. I had like a heart flutter. Sometimes I would feel difficulty like with my temperature. So a lot of, like, I guess what you would call like maybe autonomic dysregulation or dysfunction. Those are the types of symptoms that I had. And then of course the big thing, which is when I couldn't use my hands or my arms. Never had my legs affected. I could always run. Even at 45 years old, prior to diagnosis, I could run 3 miles in 30 minutes. Isn't like fantastic, but considering that I was already 45 years old and had this disease undiagnosed, I was like, okay, in terms of that. So my legs and stuff always worked. The other thing that I had was I'd wake up every single morning with the worst headache and sort of this weird head pain every single day. So throughout my life, I had a sleep study done, a very expensive one that was probably about, I don't know, at that time, I don't know, maybe $30,000. It was expensive. Insurance paid for it. A neurologist was the one who decided to do that, because I told them of all my sleep issues, unrestful sleep that I would wake up with every single morning. All of this was going on. And one of the big times that I just finally gave up. I gave up trying to figure it out. Was I was on my way right before I had quit my job at the law firm. I was on my way to work one day, and I thought, this is it. Whatever this breathing thing that's going on, I'm going to die. I had gotten off of, there's a railway system here in the Bay Area called BART, and I had gotten off of BART, and I had gotten off in San Francisco at the Montgomery Street station. And there's an escalator that goes up, and it had gone up maybe 3 steps. And all of a sudden I couldn't breathe, but I couldn't speak either. I didn't fall. I still stood there, but I thought, for sure, this is the time that my breathing is gone. I don't know how else to explain it. And I thought, this is it. This is when I'm going to die. And I'm going to die on this escalator. And whatever this is that's been, haunting me, it's finally going to kill me and nobody's going to know why I died. And I was like, and I'm okay with that because this is impossible to live with. I was already probably, I don't know, 31 or 32. And I just thought, I'm fine if this is done today because I'm done with this. I've tried so many doctors, every kind of doctor, hematologist, rheumatologist, endocrinologist. I've tried so many different people and nobody has any idea what this is. And I don't either. It's destroying my life. It's destroying my social relationships. It's destroyed, academic pursuits, destroyed building retirement, building, having the kind of job that I want. So I'm fine with it if this is done today, but it didn't kill me. I survived. As I started to get towards the top where you start to see the light, because it's underground, and I started breathing again. And I went to work, and I worked for an attorney who was a former district prosecutor, and he had been he was a lobbyist, and he was very gruff. And that day, I just remember going in, and I just told him, I just said, Jerry, I am so sorry, but I cannot stay today. I have to go to the doctor. I have to figure this out. Today's the day. Like something bad happened to me, and everyone around me knew I wasn't well. Anyone who saw me every single day, they knew I wasn't well. There was times when I would just have this deep, deep cough that would just go on endlessly. And every day I just generally looked unwell. He just looked at me and he said, okay. So I left and I went to Kaiser. I went to see a doctor in urgent care, and she said, I don't know. She said, maybe this is asthma. And I said, well, I've had pulmonary function tests. I've had a lot of stuff. And she goes, well, we'll just give you some albuterol. And the next time this happens, try it out, see if it helps. I tried it. It definitely did not help. If anything, it gave me pain. So on and on it went. I took a job I'll just say as a technician somewhere where it was just very repetitive work. And I just continued to go to doctors. I continued to try to go to neurologists, rheumatologists, endocrinologists, hematologists. Nobody ever suspected that I had MG. And like I said, a lot of that had to do with the fact that I just didn't have a typical presentation. At this point now, I probably was finally about 38 years old. And I finally saw this one neurologist, and he was very, very nice. And he really listened to me. He just told me, he said, I'm sorry. I do not know what is wrong with you, but I can see you're very distressed. But, whatever it is not within my field of study. I've looked him up, and right now he's a professor of neurology at a medical school in a nearby state. Looking back, it's scary to me because he was so, so nice. He was competent. He was sort of like everything that as a patient you would want. And yet he had absolutely no idea. MG never even crossed his mind. After that, then I really gave up. I told myself that day, if he didn't know what it was, then I've got to give up and I've got to quit stalking neurologists. Like I've got to let it go, and I've just got to live and die understanding that I am never going to know what's going on. It doesn't matter at that point what people thought or what their expectations were in terms of, it was odd, right? Like I was the one person in my family. I believe I was the first one in my family to graduate college. And then I had graduated law school, but everybody was surpassing me professionally and personally. I wasn't married, didn't have any children. None of those things were even on the horizon for me. And I just thought, I'm just going to have to accept that whatever's going on is just something that I'm just going to have to know that I'm just going to live and die and never have the answer. And I have to be okay with settling for the way that things are. And that was hard to accept. I know it, and that's good enough for me, because if there was anything I could do to change, I would do it. I've done everything I can within my power. To this point, I should say, I had neurologists who had given me brain scans, like MRIs. A couple neurologists thought I was maybe being poisoned. They wondered if anybody in my household might be putting something in, my food or my drinks, or if there was something in my environment that was poisoning me, I would go to the endocrinologist all the time because the only things that I finally got diagnosed with at 38 were like Hashimoto's, in terms of just the TPO antibodies being elevated. My thyroid is working fine. One rheumatologist had mentioned MCTD in terms of my lab work because of my RNP and my ANA. My titer wasn't too high though. And then I knew I had a low blood platelet count, low vitamin D, and low B12. Still, none of that is explaining me to myself or to anybody. Anyway, so all of this happens, and then I have some very tough days at work. Most days are tough. I was fortunate. My coworkers were just amazing. And on the days when I was struggling, they would help me. And that's how I made it through 11 and a half years at that job. And then my vision finally became so blurred. I absolutely could not see. And this is how I got diagnosed. I never turned down help. I tried everything and anything, whether it was, some holistic remedy, whatever. I tried everything, and I never turned down help. And this one particular time, my vision was so blurred that I mentioned it to my aunt, and she was working for an optometrist at the time. And so she told me that I should go see the optometrist she works for, Dr. Faith. And I said, Terry, I have been to ophthalmologist, neuro-ophthalmologist. I have been to, 8 neurologists. Like, if they can't figure out why my vision is blurred, there is no way that a doctor, that an optometrist, not an MD, but an optometrist is going to figure this out. But I thought, maybe my prescription's off, and maybe my optometrist, he's not getting it right anymore. And I didn't want to be rude and go back to him and tell him I didn't think that he had done my prescription right. So I said, maybe it is a good idea. I'll go see Dr. Faith. So I went to go see Dr. Faith, and he did my eye exam. And he said, I've got some good news for you. He said, your prescription is perfect. I just broke down crying. I immediately just started sobbing, and he was, stunned. And he said, I'm so sorry. And I said, oh, don't worry. It's not you. I said, it's me. And I said, and I'm just crying because I already knew that was going to be your answer before we even started all of this. And he says, well, what's going on? And I said, I just can't see. My vision is so blurred. I understand what you're telling me, but my vision is so blurred. And he said to me, well, what's going on? And I said, I've got a lot going on. And I said, I don't think that it's really appropriate to have this discussion with an optometrist. I said, I have a lot of different symptoms, and this is just one of them. And I was just hoping that like this would help me and that I could, to have clear vision. He said, well, why don't you tell me what's going on? And I just, and I told him, I said, I don't think this is appropriate for an optometrist. He says, no, I want you to tell me what's going on. I want to hear what's going on with you. And I said, okay. I said, if I'm honest, since I was 4 years old, something's wrong. I very tired, very fatigued every day. I wake up exhausted every day. I'm dragging myself through life. I'm peeing my pants every day. Since I was in my early 20s. When I was also in my early 20s, my hands stopped working. Then they started working again. I constantly have, blurred vision, processing issues, memory issues, all of these strange things. And I feel this very strange systemic feeling inside I can't really explain. And it's just all over my body, but I can't explain it to anybody. And it's cost me my life, social relationships, educational opportunities, just everything, just in terms of finances, everything. And I said, and I just don't know what's going on, but I know that I'm not doing it. And I know that I'm not in control of it. And the harder that I've ever tried to gain command of it, it seems to just make it worse. It's not successful. I said, so I've just learned to live a placid life, to not have people always want to encourage you to have, high hopes and aspirations and all of these things. And I learned that that was destructive for me. That's not for me. And it can't be for me because if I want that, it makes me worse. It makes me sick. But it's not the psychological problem. It's physically my body stops working. So what am I to do? He listens to all of this craziness, all the crazy symptoms. I tell him about, even when I was younger, the shooting pains, the numbness, the tingling, the muscle spasms, I tell him all of these symptoms, these crazy symptoms. And then he says to me, stay right there. I'll be right back. He leaves and he comes back And I heard him like rustling around and ran in the optometry office. And he comes back in and he comes back in with a pack of ice. And he says to me, put this over your eye. I was stunned. I didn't know what, why, but okay. So I grabbed it and I just thought, oh my God, this is so embarrassing. He's like, it was about 45, he's in his 60s, and I'm in here sobbing, and he's got a whole waiting room full of people. These people are gonna wonder, what did this optometrist do to me, or what did he say to me? And I said, maybe like not something as bad as like I have some horrible eye disease or something. And I thought, so I got to get myself under control. So I grabbed the piece of ice and I put it where he told me. And he was gone for, it seemed like forever, but it was just a few minutes. He comes back in and he said, and so, because I'm thinking he doesn't want me leaving his off, the exam room, all swollen and everything. That's what I thought the ice was for. So he comes back in after a few minutes and he has this look on his face, like this aha look sort of. And he tells me to, lower the ice. And so I take the ice off completely. And then he says to me, don't get upset. And I said, okay. And he says, has anyone ever told you that your face is asymmetrical? Because he came in with this big mirror. And right before he handed it to me, I remember thinking, oh, this is going to be one of those speeches about, Anita, you're a pretty girl. You'll be fine. And I thought, well, I'm just going to be respectful and let him tell me what he's going to tell me. So as I'm looking at myself in the mirror and I said, yeah, actually, in particular, I remember one time on a date, like it was a double date. And this person I had just met, he told me that I had some asymmetry in my irises, actually, because that was another symptom I had told him was my irises would often be off center. He goes, if you look at your face right now, he said, do you notice how your face is perfectly symmetrical? And I said, yeah. And I go, but see, this is the thing. It's not always like this. It's changes. And I don't know. I said, and because of it, I hate pictures. My whole life, I've ripped up pictures. Now that there's phones, I delete them off people's phones. I will snatch your phone and delete it if you take a picture of me because I do not like the way that I come out in pictures. I don't think it looks like me. He said, well, there's a reason for that. He said, one of the things that I noticed was as you were talking and you were becoming more and more upset, I noticed that your eyebrow on this side was going up. And he said that often happens to people when their eyelid wants to fall, and that's called ptosis. He's like, your frontalis muscle here in the front is intelligent and it knows that that's going to make your eyelid fall. So what it's doing is it's compensating and it's lifting it. And I said, okay. He goes, but ice is one of the ways in which you can tell if what was going to happen was, this process of ptosis, right? He said, and so now your eyebrows back in place. And he said, I think I know what's wrong with you. And in that moment, I believed him. What is it? And he goes, it's something I read about in optometry school. And when I saw your eyebrow do that, it reminded me that that's one of the ways in which it could present. The way that he was speaking to me at that point, I don't know if it was really fear, but maybe it was some. I didn't want to know what he thought it was. Not really. But I kind of wanted to know. And since I had already been diagnosed with, the elevated TPO antibodies and MCTD, I just asked him, I said, the thing that you're thinking of, is it autoimmune? And he said, yes. And at that point, I didn't want to ask any more questions because I realized at that moment that if it was autoimmune, that it wasn't going to go away. My mother has Graves' disease. My brother has type 1 diabetes. I knew that it wouldn't be curable. So I didn't ask anymore. And also, like, I knew he wasn't a physician and, I didn't want him to violate, anything that, he's not supposed to be, telling a patient. So I just let it go. So I asked him, well, okay, what's the next step? And he said, oh, well, you've got to go to an ophthalmologist now. And I said, oh, you know what? Thank you so much. But I have been to 8 neurologists, 7 ophthalmologists, 1 neuro-ophthalmologist, and this thing just keeps coming and going. They have no idea what it is. I have been to the psychiatrist that they've told me to go to. I just like, I can't do it anymore. And he says, no, you have to go. And I put a stubborn look on my face and he said, no, you really, you have to go. And he got stern with me at that point. And I said, okay, I will go. So I went to go see the ophthalmologist and she did all the tests. And just like usual, I passed them all in office that day. And I thought, well, this is going to turn out a whole lot of nothing. And she gave me the test to get, the lab work done. But it was during the pandemic and I went a couple times and the provider number they kept saying was wrong. I went to a local lab and they kept telling me the provider number was wrong. Then my dad got in an accident and I started taking care of him. and I just didn't get the blood work done. Anyway, then I went and I got the COVID vaccine. And in my 20s, or very early 20s, or maybe I was 19, I got the flu vaccine once, and it had caused me some horrible symptoms. For 8 months, I thought I was going to die. I was hesitant about the COVID vaccination for that reason, because I just always had a bad reaction to medications, bad reaction to any kind of vaccines, very dramatic, responses and stuff. They seem to go on forever. But it was to the point where society wouldn't let you travel. It was pretty scary in terms of just COVID itself and the symptoms. So I thought, you know what? On a day when I feel strong, I'm going to go do the vaccine. So I went and I did it. And instantly, my temperature dysregulation, like, it was just constant. It never stopped. My roommate at the time, he got the shot as well, and he had the same thing. But after 2 weeks, all of that stopped with him. It did not for me. It just continued. And slowly but surely, I started to feel an increase in symptoms, and even some more additional symptoms that I hadn't really noticed before. Sort of the same thing, but just a lot stronger. And then I thought, well, I got to get to a doctor on this. They're not going to believe me. It's not going to matter, but I have to go because I can't live like this. But right before I went to the doctor, I decided to go ahead and go get that blood work ordered that the ophthalmologist had ordered. I thought, well, whatever. It's just going to be another more blood work that's going to come back perfect. And Anita, you're fine. And no, I went and got the blood work done. And by this time, my eyelid was falling, and I could, was really struggling to keep my own eyelids open. My face and here, there was a very strange feeling. Yeah, the blood work came back and I lit it up. I was antibody positive for all 3 AChR antibodies. And this time when I went back to go see the ophthalmologist, she was just sort of detached from the process. I guess you could say emotionally, like, not, definitely not emotionally vested in my particular situation. Professional is how I would describe her demeanor. But this time when I went back to see her, she came in completely different. Because just like I sat here and told yourself this long story, I had told her everything that this had cost me in my life, whatever it is that was going on with me. So when she came back that day into the exam room, which was almost a year later, she came in and her head was down. She sat down and she was holding a clipboard, and she looked up and she said, well, so your labs came in, and I assume that you've taken a look at the lab work. And I said, I did. I saw it. And she just looked at me and she just said, I am so sorry. And excuse me? And she said, I am so sorry. And I said, well, I looked at the lab work. I can't even pronounce what that is, but I looked at it and I saw the disease online. There's no way that I have that, right? I mean, there's still got to be more tests, right? And she says, no. And then I guess I kind of, what you would say, I freaked out on her and I said, wait a minute. I said, stop. I said, just please stop. I said, so what you are saying to me is that I have that disease, that ugly face disease? Am I going to get like that? Is that what I'm going to have? All of these years searching and searching and searching, and now this is going to be it? And she said to me, and because my last question was, am I going to look like that? And then in my head, though, instantly what occurred to me is, you know what? I do look like that. It's just not as exaggerated as the photos. And I've always looked like that. So then she answers back to me. She says, I am an ophthalmologist. I am qualified to make the diagnosis, and this is your diagnosis. And I just sat there and I verbalized it to her and I said, so all of this, it ruined my whole life. And all of this ever was a blood test. That's it. That nobody thought to do because I was smart, I was a pretty girl, and I would be fine. Well, it wasn't fine. It's not fine. And she just said, again, I'm so sorry. And I will send you wherever you want to go. If you want to go to Stanford, if you want to go to UCSF, I will send you wherever you'd like to go. And they will be following up with your care. She said, as for me, she said, I won't be involved. Unless, at any point you needed an eyelid surgery or something like that. And then in that case, I would be glad to help you. And that was it. And then after that, I started seeing a neurologist. And then the nightmare continued. Because when I got to that neurologist, I think that she accepted that I had MG from the time that my arm stopped working forward. So my 20s. I do not think that neurologist accepted my version, my life which is that I have definitely had this since I was 4 years old. My new neurologist does, you could tell. So um, I guess the lesson in that is, if, not everybody's going to work for everyone. The difference between myself and probably most people that get diagnosed with MG is that I had already survived it for 4 decades on my own. So I think the challenge with the neurologist seeing me was that when you're talking to somebody who's just had an onset of symptoms and they're very, very terrified because they've never felt anything like that before in their life, that is a whole different patient than me or someone like me, because I've already survived it so many times that it was going to kill me. I really felt like I was going to die, but I've already survived it so many times that I can't even imagine my psychological profile compared to somebody who just gets it. You're just a whole different person. And I think one of the challenges is for providers is when you do get a case like mine, is knowing that difference. She did all of the standard protocols. My first one was like, you need a thymectomy, pretty much immediately. You're AChR positive. Probably cell sept is the thing we want to start you on. I want to do this. I want to do this. I want to, all of these things, which were all correct. But I told her, hold on, this thing comes in patterns. And I've looked at the research. And right now, our views with my care are not aligning. And I would like to give my body a chance to do what I've seen it do. Now, in my experience, an emotional upset or excitement, I would recover from and go back to my baseline. What I had noticed throughout the years is if it was due to a medication or due to something external, like a flu shot, like like a COVID vaccine for sure, you lose something. I can't explain it, but your baseline doesn't exactly come back. You're permanently weakened. That's just my thoughts on it. Of course, she gives me this look like, I mean, what can a doctor say to that, right? This is what I'm telling them. And she knows that I fully believe it. But at the same time, she's like, you're not a medical professional. You don't know it. And I'm looking back at her like, lady, I've been living with this for 41 years. I know it. It was interesting to go in under those, circumstances with the particulars of her personality as a provider, with my personality as a patient who's had this for a long time. So in my particular case, that was a challenge. So I've needed somebody, a neuromuscular specialist, who is sort of more flexible, more open minded. That's what's worked for me. And right now, it made such a difference in my life. Just getting the diagnosis. Once I had the diagnosis, instantly, the first time I ever took Mestinon, it was amazing. I was like, wow, this is what people feel like every day. And I just thought, I must seem so strange to people. It was weird because it was like I was so happy to have that first dose of Mestinon. And at the same time, I had this weird sort of creeping in feeling of shame because I was embarrassed. And I thought, how bizarre and how strange have I seemed to people over the years? Even when I was little, my cousins, like everybody would be excited and wanted to play. And I didn't. They just thought I didn't want to play, or I was grumpy, or what perceptions must have there been of me. I have this moment when I finally feel what it feels like to be a normal person, and all of that starts flooding in, where you start realizing just, not that you didn't already know that you weren't misunderstood, but you really have an appreciation for, because you only know your side of things that whole time, right? But then at this point now you're seeing like what everybody else must have seen. It's just so insightful. It's just a very impactful moment. That was my experience with Mestinon. And it fixed everything. It fixed the urinary incontinence that I know a lot of doctors will continue to fight back that it's not really consistent with MG. They'll acknowledge some of the autonomic dysfunction, but they say that it's not. But I'll tell you, I'm on a ton of support groups, and I run a support group myself. And there's a good chunk of us that have the urinary incontinence, and there's quite a few of us that have also, like myself, had it fixed by the Mestinon. My blurred vision wasn't fully fixed, but it was fixed up enough. But the best thing was that headache that I had every single day since I was a child gone and it's never come back since. That was my experience. I haven't talked to anybody else that's had that happen to them, but that happened to me. One of the great things about that first neurologist, even if maybe we had different philosophies or different outlooks for my care, one of the great things about her, I will say this, a lot of doctors, since neurologists that I've explained it to, they're like, oh yeah, as soon as I say it. But I can tell you, I do not think, I've been around a lot of neurologists now, and I don't think any of them would have figured it out but her, because all I told her was I wake up every single day, my whole life with a headache, every single day. And I had, because I had already had Mestinon by the time I got to her primary care provider, because I was diagnosed by the ophthalmologist with blood work. I reached out to my primary and he prescribed the Mestinon. So I went through the whole experience of Mestinon and everything without a neurologist. I didn't even see her for months because they tell you, oh, hey, you have MG. It used to be kill about 50 to 80% of people. We'll see you in 6 months, because that's neurology appointments. I mean, they're scheduled out very, very far. So, I wasn't going to stay like that. So, so I had already had the experience of the Mestinon. So when I went in and I explained to her that for all those years I had a headache every day when I woke up, she explained it to me that what a lot of doctors is that when you're laying down at night, and I'm adding in what a lot of doctors miss about myasthenia gravis, and one of the reasons why they're looking for it in the wrong ways. Like, I'm just going to say it. They're looking for it in all of the wrong ways. Because there are people that present the way I did, no ptosis, no double vision. Instead, what we have is we have that autonomic dysregulation. And that includes like urinary incontinence. Some of us, I don't know, like for me, I feel like a little thing over here, like by my heart. And all of that stops with the Mestinon. The Mestinon fixes it all. So even if there had been an argument prior to me starting Mestinon that that's not part of my condition, I'm sorry, but the Mestinon fixed it all. And so that to me is proof, because it helped me. It fixed all of that. Anyway, what she had explained to me was that headache that I used to wake up with every single morning was that basically when you are lying down, your diaphragm is working the hardest. And so that is why, because every night what was happening, and the reason why I would have like memory problems and all of those things, was because when you're laying down at night, you're able to take in air, but you're not able to expel enough carbon dioxide. Your diaphragm muscle simply isn't strong enough. So that is why unlike most people with MG, I don't wake up okay and then I get worse as the day goes on. That was never my reality. My entire life, and there's a lot of people like me, and that's why I'm saying this, I'm not special. And I think that that's one of the reasons why I share my story, and I'm trying to work in advocacy as much as possible, because I am not special. There's a lot of people like me, and their diagnoses are being missed because the presentation of the disease and the symptoms, all of those things have been narrowed. And MG is a lot more inclusive. There's just a lot more that goes with it. There's a bigger breadth of symptoms, and for that reason, it's a lot more elusive than it's thought to be. Do I think there's a lot of people undiagnosed? That lazy relative that always had excuses, that couldn't do much? I would say probably most of us are sitting with an MECFS diagnosis, a fibromyalgia diagnosis, maybe even ocular migraines, asthma. All of those types of diagnoses is where you're going to find MG patients. In psychiatry, nowadays, I know what's really popular is to diagnose people with MG, functional neurologic disorder. And then it's not until later. That wasn't around when I was young. I had never heard that term. I had never heard the other one either, factitious disorder. I had never heard those. I myself was given chronic fatigue syndrome diagnosis at some point pretty early on. So MG it's very, very, very elusive. The breadth of symptoms, the presentation of them is just so much broader than I think that physicians are prepared to look for. I think my story, if anything, it's sort of more like a cautionary tale of like what happens to a patient when they can't get a diagnosis for a long time. And frankly, when the reason for that is a fundamental misunderstanding of the presentation and symptoms of a rare condition. The question is, how do I feel about that now? Well, obviously, I mean, I've been alive, but I've lost my life to this disease. 45 years old at diagnosis, especially for a woman, that's just way too old to be diagnosed. There's a lot of things in life. You can maybe make money. But the one thing that you cannot get back is your time. So, like, one of the reasons why I wanted to talk to you today was to get that message out there that this is the reason why we share our stories, to get things to maybe change. My goal in this and talking to people and telling my story and sharing my story is that maybe somebody with the right credentials, or somebody's with the right credentials, will start to give MG a second look in terms of how they think about the presentation of the disease, how they think about the symptoms of the disease, and how they look for it. That would be like my ultimate goal for me, is basically like that's the dream, right? I will say that the reality is a little bit different. The reality is that even before that, there is the issue of diagnosis. Being in this community, I was one of the people. I guess the one lucky thing that I had is that when I tested positive for MG. I tested positive for all the antibodies. It was indisputable that I had it. I see so many, and I will say young women, because it is mostly women and young, 20s, 30s, that are needlessly given a lot of pushback because maybe they just had one antibody, one AChR antibody, rather than the three that I had, but they're very symptomatic. Some people get diagnosed with just the binding antibodies. Some people get diagnosed with just the modulating antibodies. Some people get diagnosed with just the blocking if the presentation is there. And then for some doctors, it doesn't matter. Even if you have all three antibodies the way that I do, doctors will literally tell these patients, mostly young women, that you do not have this disease because your eyelid is not drooping. And there's just nothing worse. Being so much further along in my life than they are, I just think that it's important because I was them. Now they at least have their blood work. They're on their way. So I think sooner or later, maybe that they will find somebody who will be able to properly diagnose them. All of these, I don't even know what you'd call them, medical myths that are tied to our disease, that it's got to stop. I've heard things as crazy as, if you don't have ptosis, even if your blood work's positive, you don't have MG. I've heard things like, well, it's because MG starts from top to bottom. So if your eyelids aren't affected and your vision isn't affected, then it's not possible that MG would start in your arms or in your legs. I've heard so many different things that are just simply, they're not the case. And so I think right now, I think my first goal is that there be more consistency and sort of a uniform, maybe more sequential way to figure out if somebody has MG in terms of like the blood work and the electrodiagnostic testing and all of those things. So get those things, get sort of a sequence there in terms of the testing that needs to be followed, because a lot of providers will just test one antibody, a random, they'll pick an antibody to test. Usually it's binding. And if the person doesn't have that, then they tell them that they don't have it. There has to be some sort of uniformity so that we don't have these inconsistencies where we have patients who look identical on paper, but some are diagnosed and treated and some aren't for years and years and years at times. I talk to people all the time. This one young woman, she had positive antibody blood work over 3 years ago. After that positive antibody blood work, she had had an allergic reaction and almost died during a surgery. Now she's still antibody positive. Finally, someone diagnosed her. She went in for an MG crisis about 6 weeks ago, and she had a lung collapse. She survived that. She came out of it. She wanted to find a new neuromuscular doctor just because the different medications that she had tried with hers, they hadn't really worked out. She just thought, well, maybe somebody else can be more creative with the medications. She went to a new neuromuscular specialist. She's antibody positive on all the same antibodies that I am. He undiagnosed her. He said she doesn't have it. These are not special stories. I get to know people. I talk to them. I spend a lot of time with these young women. Each one of them is unique. Each one of them is special to me. Each one of them, I do not want them going through the hell that I went through. It's just nonstop that I see stuff like this. So that's the first thing that needs to be fixed. And I don't know how I'm going to do it. But I guess just a story at a time. And then the next thing, like I said, I think it's going to be harder because I don't have that medical background. And I know there's going to be a lot of resistance to it. But look at me. I'm a case where I definitely had this. I know there's a lot of people who, oh, maybe the COVID vaccine caused it. No, 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 absolutely not. Absolutely not. All it did was it made the symptoms a bit stronger, but it wasn't just the COVID vaccine. It could have been anything. It could have been a medication. It could have been another flu shot if I had ever dared to do another one. I just never did. But it was waiting to manifest stronger in me. And that was it because I had played it safe my whole time. I was very aware of my body. And that's one of the reasons why I survived this undiagnosed was I realized every medication made me sick. Every type of vaccine or shot made me sick. So I had played everything really, really safe. And also, the biggest thing probably was the way in which I have it. For whatever reason, I had it what would always be considered moderate because it was attacking my diaphragm, but for whatever reason, it never manifested strong enough to kill me. And the couple times that I thought it was going to, especially that one time getting off of the BART and being on the escalator, I survived it. But, this is the challenge of rare disease. It's a huge, huge challenge. And, I know I still have to maintain my regular job and, live my life. But as much of my time and my voice that I can dedicate to this, I will, because look at the difference in me. Within weeks of getting diagnosed and getting the Mestinon, I had a job that paid $40,000 more. I'm still not utilizing my law degree. I probably never will. It's not something that I would even want to do with my condition.